Hello everyone. In our series of scope of each of the specialty of MDS in majorly in India, let us now welcome a maestro in himself of conservative and endodontics, our esteemed faculty at BDS to MDS, also my dear very good friend Dr. Varun Pruthi, who has been practicing much, you can say, exclusively as conservative dentist and endodontist in Delhi for last 13 plus years now. Welcome, Dr.
Thank you.
Varun.
Thank you, sir.
This
Thank you.
video we are shooting face to face in our
Yes.
studio, so thank you
Yes.
for coming all the
Yes.
way to
Yes.
this place.
Thank you. Thank you.
Coming without wasting time, let us start shooting him the questions and listen straight from the master dentist, Dr.
Yes.
Varun Pruthi.
Yes.
What is like the scope of MDS, endodontics, and conservative dentistry when we talk about in India per se?
Okay.
I'll start with a simple question जो सब जानना चाहते हैं कि
As a
MDS
postgraduate.
एक लेवल दो चीजें हमें जाननी है. चलो विल स्टार्ट विद लेवल 1. एक MDS ने एंडोडोंटिक्स लिया
Yes.
in any government or good private college or decently a good college, what he or she is going to learn in those 3 years? Is it what he has been doing in BDS, same thing, or there is a way beyond what we do learn till internship?
Absolutely. So look, what I feel that in India, at the level of BDS, we people are trained very less comparatively. So comparative to if we see that what we people are learning in MDS. So total अगर मैं MDS के बाद की अपनी लर्निंग की बात करूं, if I have learned say for example 100, तो hardly 20 I have learned during my BDS days, probably 80 I have learned during my MDS days. So as you all know है ना कि एंडोडोंटिक्स है तो रूट कैनाल तो यू पीपल विल डेफिनेटली डू, बट रूट कैनाल्स चैलेंजिंग रूट कैनाल्स डूइंग रिपीट RCT, परफोरेशन रिपेयर्स, इंस्ट्रूमेंट रिट्रीवल, तो ये सारी चीजें जो हैं वो एट ए अंडर ग्रेजुएट लेवल आप लोगों के बियॉन्ड होता है. इवन MDS जो बाकी स्पेशलिटी के हैं, when they do root canal and when we people are doing root canal, so there is a difference. The difference is almost like कि मैं हर स्टूडेंट को कहता हूं that we are like MD medicine, मेडिकल साइड. सो पेशेंट्स MBBS भी देख रहा है, पेशेंट MD मेडिसिन भी देखता है, but there is a lot of difference. The fees of a plain physician MBBS might be 100 rupees, while MD medicine may go to 1000 or 1500 also. Similar thing is in the root canals. So the quality of work which you people can give, तो बहुत सारे स्टूडेंट्स कहते हैं कि सर रूट कैनाल तो BDS भी कर रहे हैं, बट वी आर अर्निंग फ्रॉम देम ऑल्सो. उनकी फेल्ड रूट कैनाल का मैं डबल चार्ज करता हूं, है ना. सो दैट इज वन एडवांटेज. हमारी रूट कैनाल्स कंपैरेटिवली, मैं ये नहीं कह रहा कि फेल नहीं होती, बट कंपैरेटिवली कम फेल होंगी. तो एंडो में आप रूट कैनाल्स बहुत प्रिसाइज तरीके से सीखेंगे. एंड रूट कैनाल्स स्टिल, रूट कैनाल्स एंड क्राउन्स, दे आर द बेसिक, आई विल से अ लैंडमार्क, बेसिक माइलस्टोन, एक स्टेप है वो आपके लिए एक पॉश प्रैक्टिस से पहले. तो रूट कैनाल्स, क्राउन, वो हमेशा ब्रेड एंड बटर रहेंगे एटलीस्ट फॉर नेक्स्ट 20-25 ईयर्स तक का, तो जिसका हम प्रेडिक्ट कर सकते हैं. So doing a good root canal is important. Then you will learn aesthetic work, composite work. एंडोडोंटिस्ट से अच्छा कोई नहीं कर सकता. प्रोस्थोडोंटिस्ट, मैं अपने कॉलेज की बात करूं तो कॉम्पोजिट वर्क जो है वो प्रोस्थोडोंटिस्ट, पेरियोडोंटिस्ट, ऑर्थोडोंटिस्ट, बॉन्डिंग्स एंड ऑल जो है प्रोटोकॉल, वो आ ही नहीं सकता. इट विल टेक टाइम, है ना. देयर आर एक्सेप्शंस आर देयर who are from different fraternities and they are doing excellent cosmetic dentistry, but overall cosmetic dentistry prostho या cons में जाएगी, and composite typically जो है that will go to the conservative dentistry part, doing a good class 2 restorations. तो class 2 restorations में बहुत clinic पे patients आएंगे आपके पास eventually, तो जो कि क्लास 2 रेस्टोरेशंस के फेल होंगे. सो लर्निंग अ गुड क्लास 2 रेस्टोरेशन, इवन क्लास 1, लर्निंग अ गुड क्लास 1 ऑल्सो, व्हाट आई हैव फेल्ट ड्यूरिंग माय दीज 13 years of clinical practices, learning a good class 1 is also very important. So learning composite restoration, learning post and course, periradicular surgeries are less important, but learning good root canal treatment. Then the crowns are also the part of our curriculum also, endo mein. So you will learn root canal treatment, you will learn crown.
Post-endodontic restoration.
Yes, post-endodontic restoration.
Rehabilitation.
So except for implant, I will say, except for implant, you people are going to learn good amount of things. Implant is one thing which is missing over here in endo.
Because you are saving tooth, you're not extracting.
Yes,
pushing
absolutely.
it towards extraction.
Absolutely. है ना? So we are trying to say.
Your department never refers कि जाओ निकलवा दो दांत.
And we can save a lot. So I have seen many such things that extractions were indicated, but if that same patient comes to a cons-endo, he can save that tooth either by a root canal or post-end core or something like that.
Or endo-perio.
Yes,
like
definitely.
Understanding of that aspect
Yes.
also.
So you learn a lot as an endodontist in PG.
You are practicing in Delhi. You have a dedicated root canal practice. What's the name of your clinic?
It's root care. Yes.
Root care.
It's root
Because
care.
this is a power endo couple, both husband and wife.
Yes,
Dr. Varun himself,
both are
Dr. Pruthi
endodontists.
are endodontists, all India top-notch rankers of 2008.
2008 batch.
And so in these many years, do you feel like when you have been practicing in your area, ki if you wouldn't have been endo and you would have been some say XYZ other branch, it would have been better in overall terms? कभी लगा कि नहीं एंडो से बेटर है ये ब्रांच?
ये हमेशा लगेगा है ना. दिस फील विल ऑलवेज कम, बट हर फील्ड के अपने प्रोज एंड कॉन्स हैं.
आपकी तो कौन सी है?
हमारी तो कौन सी है? So like orthodontists, so orthodontists they earn very good, but उनका visiting बहुत ज़्यादा है. Similar problem is with the oral surgeons. उनका visiting बहुत ज़्यादा है. You are always there in your car or on your bike and you are just running from clinic to clinic. This is a difficulty. You cannot stay at a clinic. Prosthodontist मैं कहूँ तो उनमें कंसल्टेंसी प्रोबेबली कम है, बट इफ यू कैन हैव अ फुल माउथ इम्प्लांट केस और फुल माउथ रिहेबिलिटेशन केस, यू कैन अर्न दैट इन अ सिंगल गो. तो हर ब्रांच के अपने एडवांटेजेस हैं, अपने डिसएडवांटेजेस हैं. एंडो ब्रांच में आई विल से दैट it will never be like you cannot compete with orthodontist or with implantologist monetarily. Okay, so monetarily they can do better, but endo I will say you will have lots and lots of patients. Always there will be patients, always there will be consultancy which will be open to you people. It depends upon you whether you want to do it or not. I have done it in my initial days. 5, 6 years, 7 years I have done consultancy, but now I have stopped it totally. I'm focusing on my clinic only, relaxing now. So every branch has a advantage and disadvantages, I will say, but I'm quite satisfied. Still, if I get the same thing, so I will still opt for probably endo, cons-endo only.
So you are
no regret,
conservatively satisfied with the branch.
I can say yes.
But yes, like as on trends are changing, every branch has shown evolution in last 10-15 years. Endo का क्या spectrum enhance हुआ है when it comes to after passing out? You have seen a lot of your specialty people are venturing out into some extended venues. Like
microscopes are the good thing, but look, microscopes are for some dedicated cases only. You just cannot use microscope in each and every case. Loops probably yes you can use in each and every case, but not microscope. Microscope I will again say that especially in North India side, so if you want to do some file retrieval and all, okay, so those are challenging cases. Sometimes even after spending 2 hours you cannot retrieve the file, so you need high-end patients for that. That thing is slightly difficult over here in North India, especially in some areas. So microscopes are good if you can invest, but initially you can only invest in the loops, I would suggest, if you want to. And cosmetic dentistry has improved a lot. endo and cons, I will say it is all about materials and materials. Lots and lots of material for each and everything. Files, they have changed a lot. I remember that when we were in the PG, there was only pro taper, that universal system, and that seems to us at that time that it is such a good file. But now, if I compare it, it is such a stiff file and such aggressive cutting. So evolutionary to change will come. Again, I will say that what I have learned in my post graduation and what I have learned after my post graduation, probably after my post graduation in clinical practice, in private practice, I have learned 3 to 4 times more than what I have
See,
learned
the
in.
more you number of cases you
Yes,
perform,
and you
see,
will learn a lot.
one difference I would like to make the viewers, the doctors who are going to enter the MDS world and come out after 3 years, is try understand the basic difference. One question he answered in the beginning I was about to ask is, endo वालों को बहुत बोला जाता है you have competition with BDS doctors, but like he said, he earns more from BDS
Yes,
surrounding him
failed cases.
because when you are a specialist, like a root canal specialist, you end up taking challenging cases, which a BDS guy will have limitation to. Also, when he is putting his hands into any particular RCT, like it was my case only recently, nobody is going to put up hands in such case. That is the difference which makes you stand taller, stand above many other practicing dentists of similar, like, or like you can say BDS background or dissimilar specialities. Endodontist has definitely an edge. Dr. Varun, coming to a very you can say a baseline question which students really keep on asking me is, you have seen not everybody ends up taking a government MDS college. Many will go into private colleges as well, and the private, like a decent private college will have, they have would like have to invest a lot of money.
Yes.
Average, if you say 10 to 15 lakhs per annum will go at least in a decent college. Do you think in today's time, or maybe seeing the near future of 3 to 5 years from now, is it worth spending this much money on a branch, especially like endodontics and cons?
Again, look, I will say it will depend upon your finances. If your finances are fairly good, if you people can afford.
Basically, ROI factor of this. Suppose I have invested 30-40 lakhs on this. When I come out, is it worthwhile that as an endodontist, I will be able to recover my money back?
Again, I will say if your finances can allow. So look, finances wise, if I say, so finances wise, so they say that you people should never buy a home. है ना? They people say, if you have money, you invest. But many decisions what we take na, they are not on rational basis. Many are on emotional basis. You know? So emotions are also, they are going to play a part. So if you have a decent amount of money, fairly good amount of money, which you can invest, then doing MDS from a private institute is also a good option. Look, initially, when you establish your clinic, government jobs, fairly, they are too less in dentistry. Fair, government job means from government colleges. I'm not talking about any medical officer job which opens. So government colleges job like assistant professor, associate professor. So they are less. You people, majority of you people are going to open a clinic. So when you people are going to open a clinic, a tag of MDS is still important. So you will see there is a difference. The difference is in our mindset, the mindset of our general public, that if this is MDS, then probably he will do a better work. And this will be there for say couple of years, 10, 20 years. After 20 years, you will have your niche, your patients chain will be there, who will never see your degree, whether you are BDS, you are MDS, or you have a fake degree. And it will not matter to them. The thing which will matter to them is your quality of work, that whether you are giving him pain or not. But initially, it can matter. Then being an MDS, there are many portals which opens for you people. Like being an MDS, when I pass out, so I have lots and lots of consultancy which was available to me. Especially if I'm from
nowadays also, endo gets
consultancy
very
will,
fast.
endo advantage is the consultancy will always be open to you people. it's your wish whether you can travel or you do not want to travel. But consultancy option will always be there open as an endodontist. Then again, I was an endodontist at some renowned hospitals also. I'm teaching over here also in the institute immediately after I passed out in the year 2011. So MDS opens many such chains, side businesses which opens. So your clinic, you are much more confident when you have opened your clinic. I get many big patients, many VIP patients because I'm MDS from MC. So this thing also, you look, there is a
Always.
tag which is there, with these branches. So the tag is also important. Plus, if you are doing in some good branches like ortho or like prostho, so money probably after a period of time, after 3-4 years, 5 years, you can easily recover that 30-40 lakh which you have invested. So if you can afford, if finances allow, if your family can afford easily, then doing a branch from a private college also, it's worth it.
Dr. Varun, like a lot of insight on all these financial part also, and this last bottom line is like when we are entering a college. Okay, when we are entering a college, we are supposed like you are totally addressing to those who have just taken up endo now.
Okay.
What is your piece of advice? Suppose they watched your video, they got motivated also, and they
want endo.
They want endo as a branch.
Okay, as a pursuit career. Okay.
Two things I want to ask here is what are the special traits you feel one should possess to become a good or great endodontist like you? Second is, what is your piece of advice to them who will be spending 3 years in your branch?
Okay. So look, no special trait, I can say. So I was just a very mediocre guy if you talk about the dexterity or sometimes the skills or the handwork which you people feel that we should have a good amount of that clinical work which should be there, the dexterity of the hand which should be there, good skills which should be there if you want to opt for endo or prostho. So I was a very average guy during my BDS days. My clinical work was merely okay. But yet in post-graduation, you can change, you can turn the table. So it is not necessary, please open up your mind that it is not necessary that you need to have a good clinical work that you have, then only you can opt for these fine branches like endo. Because at the BDS level now, we have no knowledge. First thing, we have not read the endo part decently. Then there is nobody to teach us also. So this thing changes the moment you enter into the post-graduation. You will read on your own. You will have some senior resident or faculty which is there to help you guys. So you will learn a lot during your post-graduation days. So only thing is that yes, it requires time, it requires patience. And do not believe that after doing endo you will get miraculously rich and all. That things probably happen with the implantologist, but initial days you are going to learn, and it's a hard work totally. And sorry if I got the second part.
What is the advice like to emerge as the greatest in the field? So
one more important thing, which if some postgraduates, many postgraduates, they connect with me during their post-graduation.
Because you have seen at least 13 batches passing out after you.
Yes. So many postgraduates, they contact me that, sir, what different should I do? So my advice to them is that during the post-graduation only, you should do some courses. If it is allowed by your guide, if they can give you some 2 days, 3 days vacation, so go and pursue some courses. There are some good courses which are there in North India also, as well as in South India also. And those exposure, then you can practice it during your post-graduation only in your patients. So you have now the knowledge also, because those courses, those 2-3 days courses, you will get so much of the knowledge in that 3-day course only, which you cannot otherwise have even after reading for 3 months.
It's basically learning a new skill
Yes.
through those short courses,
Yes,
so that you can apply them in
apply
your
them in your
PG.
PG only. So
Why to wait after that?
yes, don't, because after during PG time, na, you are in a euphoric state. So you are ready to spend, you are ready to invest your time, everything. Probably after post graduation, there is a thing which I feel that there's certain decline which comes in learning and all. Na.
Earning is the main factor.
Yes,
After
जो
that.
zeal जो होता, हाँ, earning is the main factor. So during my post graduation, I have invested too much. So my advice is, probably what I missed is कि I should have attended some good courses, some 3 days courses, 4 days courses on cosmetic dentistry, aesthetic dentistry, in
Now they
endo
are readily
also.
available in India at a
Yes.
very meager cost.
Yes,
like
in
not
endo
much.
also probably. And those 3 day courses, they are, I'm telling you, they are much more beneficial to you people. So do them in first year, second year, third year, every year.
That's a
at
really
least
good piece of advice
every
to
6
all
months.
those who will
Every
be
6 months, 3 days course.
entering MDS into any specialty per se, not only conservative and endo.
Yes.
Because in your PG days, you have time to experiment also. Like with, you can take some challenging cases if you are well trained and educated about that priorly.
Yes. Yes.
So, thank you, Dr. Varun. Thank you very much for this great interactive session
Thank you.
and putting a lot of insight of your specialty. May God bless you with much more success in the field, like always. He is one guy in Delhi. We say with today, I don't know why modestly he is saying he doesn't have a good, never used to have a good hand in BDS days, but I know him as the best hand you can be in a dental chair when it comes to the topic of endodontics and conservative. Safe hands, the safest of all in Delhi at least.
And one more last piece of advice to all the students, that remember, yes, definitely the stipend, it matters. If you can have good stipend with a good college, best thing. But otherwise, do not be afraid of going too far south, especially if you are a North Indian, you have some mental block that I want the seat in North India only. Please don't have this mind block. Even if you are having a lower amount of stipend, say if otherwise you are getting a 1 lakh stipend in North India and you are getting a 40,000 stipend in South India, but with good clinical branch, do not compromise on your branch because of the state. Okay, never compromise on your branch, because it is just 3 years. Ultimately, you will be endodontist for lifelong. So you can learn many things. You can come back to Delhi and even being a prosthodontist, so you will be a prosthodontist for your whole life. So do not compromise on your branch, compromise on your stipend, compromise on your state, everything, but try to pick a branch first. Okay. So, thank you.
Thank you.
Thank you. Thank you.
Thank you, everyone.